And now for the latest on the pandemic and what's next, we welcome back Lieutenant Governor and the state's COVID-19 liaison, Dr. Josh Green. Good morning, Lieutenant Governor. Thanks for joining us again.
Good morning.
Let's go ahead and begin with the numbers. It appears the cases and the hospitalizations continue to drop across the state. These are positive signs.
They are very big drops. We peaked for case counts on the 21st of January, and that drop has now been significant. We're 41%, just under 41% off of our peak. Yesterday, we had 35,053 active cases as opposed to 58,000 active cases on the 21st. And then our hospital counts have dropped subsequently, and we always know they follow about a week later. They're off 20.4%. So we peaked just around 400 with the Omicron surge, and we were at 313 people in the hospital by midday yesterday. So that's a big drop. That means we will then see less morbidity and then hopefully fewer fatalities in about 1 to 2 weeks. So big changes for the better.
Let's talk about the vaccine for children under 5, for babies and toddlers, because a lot of parents still have concerns and questions about it.
Yes, we all do. I have a child that's 11 and a child that's 15 that were in the other two categories. We are going to see authorization for this vaccination. It will be a deeply personal choice for parents of children 6 months to 4 years. What they've done is, and we've talked to our pediatrician, Dr. Tensala, who's terrific, we've asked her, what is the recommendation to families so that they don't worry? Well, what they've done is they've lowered the dosage down to a very low dose, to a 3 microgram dose. It's much higher, it's 30 micrograms for adults, and then lower for children, and then very low for little children. But our keiki that are between 6 months and 4 years old represent about 88,000 people in our state. Families will have to decide, and they've been polling across the country. It looks like somewhere between 25 and 30% of families may choose that for their children. We have seen some kids get quite sick across the country at that age category, and the vaccinations prevent severe illness.
Now, last week, the governor said a booster shot would be required to enter Hawaii if travelers wanted to bypass quarantine or a COVID test. What's the latest on that? Has a date been selected on when that would start?
No. So the governor was traveling until last night. So for the last week, he was on some governor duties on the mainland. What we're looking at now is whether or not to simply have additional advisories from our Department of Health. We've seen these numbers come off very steeply. What we want is people to be up to date on their shots, meaning have their 2 shots and then get the booster when they're eligible. But it might simply be unnecessary to require a booster to come into the state. It's somewhat confusing for people because the rest of the states don't require this. So the governor will make a final decision when he gets here. But we had lots of meetings this last week. Instead of these mandates, it might be the old way, which is guidance from health directors and health experts that will carry the day. So let's wait and see what the governor says this week. I would hope that we can simplify and move off the restrictions in the near future because we're doing so well.
Do you know what changed? Because it was just about a week and a half ago when the governor told KHON2 that a booster shot would be required for travel, and now there seems to be some kind of change of mind that maybe that's not needed. What happened in that time frame?
We were able to convince the governor that the case counts are plummeting and also our hospital counts are getting much lower. Meanwhile, you saw in the news today that we've been trying to survive economically throughout the whole year. Last year, because of safe travels, we were able to keep our cases second lowest in the country, but bring back 6.8 million travelers. Had we not done that, we would have seen everyone go bankrupt that had a small business. We would not have been able to pay for our kids' tuitions. We would not have been able to pay for groceries. So it really is striking a balance. Tourism continues to be off about 25 to 30%. We must put healthcare first and the health of our people first, but we're seeing really few hospitalizations now from Omicron. So Omicron is less severe, 5 times less likely to put you in the hospital, and we're very well protected in our state. We're 75% fully vaccinated with 2 shots, and we're over 30% with a booster. That's 502,000 people got boosters. So we're trying to convince the governor to balance public health and survival on all these other fronts. And that's the discussion, but he'll make the final decision with the mayors.
All right, well, speaking of survival, some states are looking at an endemic strategy or an endemic transition. Can you talk more about an endemic, what that means for all of us, and if Hawaii is looking at some kind of endemic plan?
Yes, so when you look at endemic, that means that the virus is there, but you're not seeing large case counts. And so the way to do that is to have surveillance testing, get a good idea at all times exactly what the base rate of the virus and spread is in our state, Also, we constantly will look at hospitalizations. We have such a good HUI now of all of our healthcare executives and chief operating officers and medical directors. They communicate constantly with me and the Healthcare Association. So when it's endemic, what you do is you know when it's spiking slightly. That's when you make recommendations like social distance and masking, and you continue to encourage people to be fully vaccinated, which really is going to be 3 shots once this whole thing is over. So that's the endemic strategy. But meanwhile, when there are small spikes, then you can institute some recommendations without having restrictions. That's what endemic will mean for us in Hawaii and probably elsewhere. You saw today that New Zealand is now going to open up again. That's a sign that the states that were the most conservative in the country, in the world, are realizing that you have to live with this.
I believe I saw Denmark was planning to drop all restrictions as well. Of course, their full vaccination rate is higher than Hawaii, but other countries are kind of taking steps forward as well.
Denmark might be the only country that's higher than Hawaii. I mean, we are amongst the highest vaccinated states. We have the second lowest death rate and the second lowest case counts because of what the people have done. So I just am so appreciative of how our Ohana pulled together. We'll be able to come down off of some of the restrictions. And that's why we may ultimately see the governor recommend this guidance, this healthcare guidance, rather than additional restrictions. But that doesn't mean we won't be safe. We've been the safest state, with the single exception maybe of Vermont and Maine, respectively. But we are going to have to live with it. And that's why it was quite smart for you to recommend or discuss endemic states, because that's what the world will deal with going forward.
Well, we appreciate your time. We appreciate that update, Lieutenant Governor. And whenever the governor does make any kind of decision, a change, of course, we'll pass it on to the viewers. Thanks again, Lieutenant Governor, for joining us this morning.
You bet. Thank you.